Relax, buddy. Relax. Relax. Open, please. I see you've had one filling, but it looks like it's still intact and it's very healthy, so it's good. Back of your teeth look good. Right. I'm going to prepare my tools. I'm going to perform another visual inspection quickly to check that everything is the way it should be. Do you floss every day? You brush your teeth 2 to 3 times a day? Okay. Your gums look pretty healthy, but I will have to do a deep cleaning of them just to ensure that your oral health is maintained. That shouldn't be an issue. And so we'll go ahead and get started. So I'm going to take my mirror here. I'm going to take this tool, which is to help check for any... Right. Let me know if I hurt anything. And if you need a second to close your mouth, let me know. Or if I hurt you in some way, just let me know as well. Teeth looks good. There's no discoloration, which is superior. I don't see any signs of further cavities, which is great. Again, your gums are not inflamed. Right. Let's see. Looks like you have a couple chips on these teeth, but they're small. Have you ever taken a direct hit to your mouth before in sports? No? Okay. Back of your teeth looks good so far. I'm going to go back and check. You floss every day? Okay. Good. I can tell. Sometimes people come into the clinic and they don't floss enough, and I have to take basically the last 6 meals out of their teeth, and it's kind of gross. So, thank you for flossing. Ooh, sorry, I mean to nick you. There's a bit of a recession there, where your tooth goes into the gum. It's a bit deeper than I would like, but it doesn't look too bad.
I don't need a root canal, do
I? No, you don't. I don't see any cavities of any sort. Unless, of course, you'd like a root canal, then I suppose I could give you one.
Mm-hmm.
But you probably don't want that. Do you? Teeth look good. I'll have you turn this way just a little bit so I can check the back teeth. I would say your gums are not receding, but they are a little shallow compared to some of my other patients, but it's not something to be worried about. And I don't see much plaque buildup, which is definitely a plus. Again, great job with your flossing. All right, I'm going to change gloves quickly so I can continue with the procedure. But I appreciate you coming in to have your teeth cleaned today. It's kind of been a slow day, so this has been nice, I guess. And my hands are a little sweaty, but we will get these gloves on. So what kind of foods do you like to eat? Do you have anything in particular that you like?
Anything really. I'm not really a picky eater.
Good. Well, the good thing is I can't tell because, again, you floss, so I don't have to.
That's a good thing, though.
It is. Just getting these gloves on. But no, I'm very pleased to tell you that your oral health is very good.
I take great care of my teeth.
Good.
Doctor Mike.
I said some patients come in here and they don't brush enough, and that leads to gingivitis, which is a inflamed gum disease, which can lead to all sorts of oral health problems, and no one wants that. It's not fun to have a cavity filled, or when you have a root canal, or something similar to that. So, thank you for making my job a little easier. I will say, when I was looking in towards the back of your teeth, you could do a bit of a better job of brushing back there, but that's normal for most people. It's harder to brush back there. Yes, exactly. And so I would just recommend that you take a closer look when you're brushing. You can angle your toothbrush a bit more to cover more ground surface on the surface of your teeth, and that will lead to you being able to pick up more plaque buildup. I'd also advise, if you can, if you can't, then it's understandable, but it is recommended that you brush your teeth immediately after a meal and floss. So if you can do that, that's fantastic. If not, no worries, just brush your teeth as soon as you can. I'm going to have another look just to ensure that I didn't miss anything. Looks good for the most part. Don't see any extra buildup. Okay, you good? Okay. I'm gonna look behind your molars. Looks good to me. You floss back there too? Good. I'll look on this side. Perfect. Put your head this way a little bit, please. Thank you. Good, I don't see any buildup, or at least none that I've not already removed, so I will continue cleaning your teeth. This tool is to further clean the surface of your teeth, so I'm going to do that quickly, just to double check that everything is good. This also aids in removing surface stains, which is good. Do you drink coffee? No? Okay. Coffee has been known to stain your teeth and darken the enamel on the surface of your tooth. So it's good that you don't drink coffee. I would not advise that you start anytime soon. Most people drink coffee, but I will say from the standpoint of oral health that you're much better off not drinking coffee for the sake of your teeth. There's less to worry about, less problems, and you don't get that nasty looking brown color from the stain of the coffee beans. So that's a bit of new information for you. Look that way, please. I'm just going to make sure that they did this filling correctly. Looks like they went a bit over the enamel of the tooth, but it's not loose or anything. I'm feeling that right now. This looks good to me. Okay, perfect. Let me know if I hurt you or anything, and I will readjust my grip. Look back this way, please. You're doing great so far. Thank you for being a good patient. Had to do a toddler the other day, and she was screaming all over the place, and it was not fun. Doing infants is probably the worst part of the job, because they cry and they scream, and you can't get them to sit still, and I'm not that scary, am I? No? Good. Feel like you have a bit of a chip here on the surface. You feel that? Feel that little bump right there? Okay, well, there's a small bump right there. So, oops. There's a bit of buildup right there, so I'm going to take care of that. All